Welcome to today's video on how nurses manage heart failure. Let's dive into the step-by-step nursing management of this complex condition. First up, assessment. This is where it all begins. Nurses gather vital information about the patient's physical condition, medical history, and symptoms. Key components include monitoring vital signs like blood pressure, heart rate, respiratory rate, and oxygen saturation. A thorough physical examination is crucial to check for signs of fluid overload such as edema, jugular venous distension, and ascites. Asking about symptoms like shortness of breath, fatigue, and difficulty breathing when lying flat is also essential. Daily weight measurements help detect fluid retention. Reviewing lab results and interpreting diagnostic tests like echocardiograms and ECGs complete the assessment. For example, imagine a patient with heart failure who reports increased shortness of breath and leg swelling. The nurse notices pitting edema in the ankles and a 3-pound weight gain over 2 days. Blood pressure is elevated and BNP levels are high. These signs suggest fluid overload, prompting the nurse to notify the healthcare provider. Next is diagnosis. Based on the assessment, nurses formulate nursing diagnoses to guide the care plan. Common diagnoses include excess fluid volume related to impaired cardiac function, decreased cardiac output, and activity intolerance. Ineffective breathing patterns and knowledge deficits related to disease management are also considered. Moving on to planning. Setting goals and outcomes for the patient's care is essential. Short-term goals focus on stabilizing the patient's condition, relieving symptoms, and preventing complications. Long-term goals aim to improve functional status, enhance quality of life, and prevent hospital readmissions. For example, a short-term goal might be to reduce the patient's fluid volume within 48 hours. A long-term goal could be educating the patient on self-management techniques to prevent future heart failure exacerbations. Now, implementation. This is where the plans turn into actions. Key interventions include administering prescribed medications like diuretics and ACE inhibitors, and monitoring for side effects and effectiveness. Fluid and sodium restrictions are implemented, and the patient is educated on their importance. Continuous monitoring of vital signs and weight is crucial. Supplemental oxygen may be provided if needed, and patient education covers medication management, dietary restrictions, and recognizing early signs of exacerbation. For instance, the nurse administers furosemide, a diuretic, as prescribed, and monitors for signs of decreased fluid overload, like reduced edema and improved breathing. Education on a low-sodium diet and the importance of daily weight monitoring is provided. Finally, evaluation. This step assesses the effectiveness of the interventions and modifies the care plan as needed. Evaluating the patient's response to interventions, reassessing the condition, and gathering patient feedback are key components. For example, after 48 hours, the patient shows decreased edema, improved breathing, and a stable weight. The nurse evaluates the effectiveness of the interventions and continues to monitor and educate the patient. In summary, by following these detailed steps, nurses can effectively manage patients with heart failure, improve their quality of life, and reduce the risk of complications and hospital readmissions. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more informative videos.